Hi, my name is Mandy Weaver and I'm a nurse practitioner here at Southeastern Orthopedics with Dr. Kevin Speer. Today you're watching this video in order to prepare for your upcoming rotator cuff repair surgery. So first of all, you want to make sure that you do have somebody to take you to the hospital and drive you home, and they will need to be with you the first 24 hours after surgery because you will be receiving anesthesia for this surgery. You want to make sure you don't eat any food after 10 p.m. the night before. You are allowed to have water or clear liquids up till 3 hours prior to your surgery. And we'll go over your specific medications that you may need to take that morning and let you know which ones are okay to take with some water. Morning of surgery, what we'll need you to do is take a shower. Wash as you normally would, and then you want to use the scrub brush, which we'll provide. You want to scrub down the front of the arm, back of the arm, underneath the armpit. Rinse it off just like you would soap, and you want to start about at the base of the neck. Make sure you cover that whole shoulder area, front and back, and down the arm. Rinse it all off like soap. When you get out of the shower, no deodorant under the arm, no lotion, no cream on that arm. A frequent question is what to wear home from surgery. Best thing to wear is a button-up shirt or just a loose-fitting oversized shirt, because when you come out of surgery, you're going to have a sling on, and then you're just going to put your shirt over that sling. So just make sure you wear something really large and loose, or a button-up works really well. When you get ready for surgery, you're going to see anesthesia prior to surgery, and they're going to give you a nerve block. So what that is an injection. It's at the base of the neck, and that's one of the things to help with pain after your surgery. Before they give you that, they're going to give you some medication to relax you and some pain medication to prepare you for that. So the block is a numbing medication. It's called Exparel. That will last for about 2 to 3 days to help with pain after surgery. The first 12 to 24 hours, it'll be completely numb where you shouldn't feel anything. Anytime after then, you might start gradually feel it kind of waking up a little bit, but you won't get full sensation back until about 2 to 3 days, which is normal. At any time, if the block should wear off sooner than that for you, it is okay to take pain medicine. As soon as you start getting some feeling back in that arm, you can go ahead and take that. And we'll discuss, you will be given an opioid pain medication, and that'll just depend specifically on you and your history. So we'll discuss specifically with you which one that will be. And that will be provided for you before your surgery. That will be sent to your pharmacy, so you'll be able to go ahead and pick that up. Now, so you'll have your block for anesthesia, then you'll go in the operating room. They will give you IV medicine to put you to sleep. No tube down your throat. It's not general anesthesia. You will be breathing on your own the whole time. You'll have 3 incisions, one on the front of the shoulder, one on the side, and one on the back. They're small incisions, 1/2 inch to 1 inch with stitches, and then you'll have an open incision along the top of your shoulder. That's where you're going to repair the rotator cuff. Now that dressing, you just want to leave that dressing on your shoulder. You're going to shower with it on, leave it on for 2 weeks until you follow up with us, and that's when we'll take the stitches out. And we'll let you know that follow-up appointment once we talk before surgery individually. So you'll have the dressing on, you'll have a sling on when you come out of surgery, and that sling should kind of fit, right across your stomach here at about 90 degrees, as this is the position it should be in. So we'll put that on you, and we'll also put on an ice machine, or it's called a polar care unit. What that is a cooler, and it's about this size. It has a tube that connects to some straps that go all around the shoulder. We'll go ahead and put that on you right after surgery, and you want to keep that on the first 3 days after surgery, okay? Keep that going day and night. You want to keep that ice on, and you'll like it because it'll numb the shoulder also, so that helps with pain, and it'll help with the swelling on your shoulder. All you do to that cooler, fill it up with water. There's a fill line that you'll see. Fill it up with water and put ice in it. What you can do instead of ice is frozen water bottles. You want to get water bottles that are about 16-ounce size. Go ahead and freeze, about 8 to 12 of those as many as you can. About 4 of those will fit in that cooler. That way you don't have to replenish that ice quite as often. But the ice, once again, is great. So you're going to keep that on the first 3 days after. on the third day after your surgery, that's when you're able to shower, because you want to make sure you can feel that arm, that sensation has totally came back before you bring it out of that sling, okay? So as long as you can feel that arm on that third day, it is okay to go ahead and take it out of the sling, and you can straighten it out beside you. That's okay. And go ahead and take the ice off. Leave the dressing on. Remember, it's waterproof. And keep that on till you come back to see us. We do not want that incision getting wet underneath that dressing. Keep it nice and dry. So you can straighten out your arm, but what you don't want to do is kind of reach here. You don't want to reach up here. You don't want to reach behind your back. No lifting, pushing, pulling, none of that, just arm straight at your side. People often ask how to wash underneath their arm because we don't want you to raise up your arm to wash under there. So what you can simply do is when you're standing, just lean forward a little bit, okay? And that's gonna bring out your arm a little bit in front of you, and then you're able to safely wash underneath that arm without raising that arm up in front of you, okay? So that is fine to do. When you get out of the shower, you want to go ahead, put that sling right back on. At that point, it is okay to go ahead and put your shirt on, put your sleeve on down here, not up here. Go ahead and put that shirt on, and then put the sling on the outside of your shirt. Okay, that's okay. You don't have to keep wearing, the sling here and the shirt over, but that is how you'll leave the hospital. Just kind of keep that in mind. But then after, put your shirt on, normal person, put the sling on the outside. And then you're gonna wear the sling, it's typically for 2 or 3 weeks after surgery, and we'll let you know what that length will be for you, because it'll depend on you individually in your surgery. Now, when you come out of that sling, that's when you'll start physical therapy. And that'll be 3 times a week for about 8 weeks. It's kind of split up into 2 different phases. We call it phase 1, phase 2. The first phase, you will have some restrictions on for the first 4 weeks, and then you'll come back and see us. We'll reevaluate you as long as everything's going well. Then you'll move on to that second phase where you'll be able to do more exercises. When you come out of that sling, it is important not to lift anything heavier than 1 pound or a can of Coke for reference. And that's for the first several weeks once you come out of that sling. What you want to work on first is stretching and just getting the movement down and the motion down. And then slowly resistance can be added in. And physical therapy will work with you to do that. But it's just important on your own when you're at home, you're out of the sling, moving around, just be careful not to lift anything with that arm. Sleep is always a hard thing after surgery, so if you have a recliner, that's a good place to sleep at least the first week after, or if not longer, just to make you more comfortable. If you don't have a recliner, a wedge pillow works well, or some firm sofa pillows, just to kind of prop you up in bed a little bit is a good idea to help you get a little more comfortable for rest. Now you might notice a lot of bruising kind of down the arm or even into the chest a little bit. It may extend all the way to the opposite side of the chest. You'll notice that about a week after surgery. That is normal. It's just part of the surgical process. It does not mean anything is wrong at all, okay? Normal finding. You might also notice some swelling kind of down the arm from the elbow down. Maybe the hand is pretty swollen. It's okay to do gripping exercises. With like a soft rubber ball, rolled up washcloth works, anything in your hand that you can just kind of get a gripping motion with, and that'll improve that circulation because it can be common for the fluids to kind of pull up there in the arm while you're in that sling position. So that is fine to do. Motions from the elbow down are okay to do when you're in that sling, type in or, on your phone, those sorts of things, as long as you're not lifting any weight. Those types of things are okay to do. Now the ice, after that third day, you don't have to keep it on all the time as we mentioned, but still do use it, at least once or twice a day for, about 30 minutes to an hour each time, or use it more. You can't use it too much, but just make sure you remember that ice because it definitely will help with the pain and the swelling. Make sure you do have something between your skin and that ice pad. When you leave the hospital, they'll have a pillowcase there. So a pillowcase works, a towel, on the t-shirt. Just make sure the material of the t-shirt is a little on the thicker side. If not, that pad can give you some burns there, and what you'll notice is some red circles that you'll have on that shoulder. Now, medications for after surgery, we'll talk about individually before, and we'll let you know which specific ones, and we'll go ahead and send those to your pharmacy for you. So that'll be an opioid medication. It is important to make sure you have a stool softener along with that medication, because those can be constipating. And those will be listed on your instructions. That'll be like Miralax, Senokot, Dulcolax. Those are a few examples of those. Please drink a lot of fluid after surgery, because you will be dehydrated after that. Another medication is Tylenol. It's fine to take along with the opioid medication or instead of it, either way. 2 extra strength Tylenol 3 times a day, and that's a good idea to take the Tylenol. We recommend about the first 2 weeks after your surgery. We will give you a medication for nausea, and we'll discuss what specific one that is for you, just in case you need it from the anesthesia or the pain medications after your surgery. And then another thing we'll have you take is anti-inflammatory medicines, such as Aleve or ibuprofen, and we'll discuss that and make sure it's okay according to your medical history. So we will talk more about medications when we speak individually, but just to kind of give you an idea, these are some ways to help manage the pain after the nerve block, the pain medications, the oral pain medicines, along with the ice, and definitely use that ice as much as you can. There is more information about the block, as I mentioned, and the ice machine, and there's a quick little video that you may want to look at, and that's listed in your instructions with a link that you can watch, and it kind of just shows you what it is and how to put it on and take it off. So that's good to look at as well. I think we have concluded everything to go over in order to prepare you for your shoulder surgery. Hopefully this has answered some of your questions. Be sure to give us a call if you think of any other questions or concerns or something individually that you think of. We're always here for you, so give us a call, and we hope we can make this process go as smoothly as we can for you. Okay, take care.